So there I was, Disney World, the happiest place on earth. And when my oldest was about 4, he came back from a full day at the park with his souvenirs, a Mickey sports bottle, one of those spinny light toy things, and 101.8 degree fever. Seriously. Now, here's the thing. I'm a pediatric PA. And at that point, I'd been doing this for about 2 years. I saw fevers all day long. I knew what a fever meant, what it didn't mean, and what it actually mattered. And yet, standing there in that hotel room, surrounded by half-eaten chicken nuggets and discarded Mickey ears, I still felt it. That little flutter of, what if? What if it's something more? What if I missed something? What if being his mom is making me blind to something that I'd catch in a patient in a heartbeat? I felt like I knew everything and nothing all at the same time. In that moment right there, that's why I do what I do now. Because here's the truth nobody tells you. Having the knowledge doesn't eliminate the feeling. It just gives you something to do with it. And that's what we're talking about today. So let me back it up a second. If we haven't met yet, I'm married. I'm a pediatric physician assistant, and I've been practicing for over a decade. And I've seen pretty much everything. The weird rashes, the mystery fevers, the kid put what in his nose situations. I've also seen a ton of scared moms. Moms who've been up all night Googling symptoms. Moms who walk into my exam room already convinced that their child has something rare and terrifying. Moms who apologize for overreacting when they're just doing what good moms do. They're paying attention. And I get it because I'm also a mom of 30. So my kids keep me very humble. One of them once said, "Mom, you're perfect." I said, "Oh, thank you, honey. That's so sweet." And then he said, "Yeah, they need to be fatter. Like you. Mom, you're fat." Thanks, honey. So I'm not some perfect Pinterest mom. I'm the mom reheating her coffee for the 4th time. I'm the mom whose toddler just pooped in a full bathtub. And I'm the mom who has spent 45 minutes scrubbing SPF 50 out of the living room carpet because my toddler decided she could do it herself. And no, she couldn't. So that's real life. But being both a pediatric PA and a mom gives me something valuable. I see both sides. I see the clinical side, how kids' bodies actually work and what symptoms usually mean. And I see the mom side, the fear, the guilt, and the mental spiral when your kid is sick and you're trying to decide if this is a big deal or not. That's why I started Miss Mary PA. Not to tell parents what to do. That's your pediatrician's job, but to teach you how to think. So let's talk about the real problem. Here's what I see all the time. A child comes in with a fever or a rash or a cough, and the symptoms themselves, often very common, but the parent is already overwhelmed. Not because the symptoms are severe, but because the internet doesn't know how to give perspective. The internet is like a boardroom where everyone is shouting a different priority all at once. It's all noise, no strategy. It tells you everything a symptom could be associated with, but it won't tell you what's likely. It won't tell you what's common, and it won't actually tell you what matters right now. So by the time you're looking at your child, everything feels urgent. Everything feels scary. And I want to be clear, that doesn't mean you're anxious. It means you care. The panic doesn't help you think. And thinking is what helps you take the right next step. Your job as a parent is not to diagnose. Your job is to observe, organize what you're seeing, and communicate that clearly. The diagnosis? That's for your child's healthcare provider. But the thinking part, is this a 2 a.m. problem or a 9 a.m. problem? That part is a skill, and it's one that you can learn. Now, here's where it gets practical. Calm moms don't worry less because they care less. They're not calmer because they're better moms or more laid-back moms. They are calm because they have a framework. They have a way to organize what they're seeing, so fear doesn't run the show. That's why I teach something called CALM. This is how I think through symptoms, both in clinic and at my own kitchen table. Let me walk you through it step by step. The first part of the framework is C, which stands for change. What has changed? Is this new? Is it getting worse? Is it different from your child's normal? I don't mean compared to the kid next door. I mean compared to your child. You know your child's baseline. Change is information. Now, moving on to the second letter. A is for activity. How is your child acting? Are they eating? Are they drinking, playing? Are they responding to you? A child with a high fever who's still engaged in drinking is very different from a child with a lower fever who's lethargic and disconnected. Numbers matter, but behavior tells me more almost every time. The third letter is L, which stands for length. How long has this been going on? Something that started this morning is different from something that has been lingering for weeks. Patterns matter over time. Even rough timelines help. And finally, the big one. M stands for matters. Is there anything here that matters enough to change the plan? Now, let me explain what I mean by the plan. When your child gets sick, you already have a default plan, even if you haven't said it out loud. Maybe it's, I'll keep an eye on it tonight and I'll call the doctor in the morning. Or I'll give Tylenol and see how they do. The question is there anything happening right now that should change that? Is a symptom worsening faster than expected? Did something new show up? Does your gut feel like something shifted? This is where calm really lives. When you're worried, everything feels important. Calm helps you ask, what actually matters right now? Learning to separate the signal from the noise is a skill. And once you have it, everything feels more manageable. So how do we use this? I want to give you a really practical way to apply the calm filter. Here's the question I want you to practice asking. Is this a 2 a.m. problem or a 9 a.m. problem? A 2 a.m. problem means wake everyone up and seek care right now. What does that look like? It looks like trouble breathing. And I don't mean just a stuffy nose. I mean actually working hard to breathe. It looks like unresponsiveness, like your child can't be woken up or isn't tracking with you. It looks like something that feels deeply, unmistakably wrong. Those are your 2 a.m. problems. A 9 a.m. problem means this matters, but it can wait for a call or an appointment. What does this look like? It looks like a weird rash, but your kid is acting totally normal. It looks like a fever, but they're still drinking and not completely miserable. It looks like they threw up once, but they're still keeping down fluids. And here's the truth. Most childhood illnesses are 9 a.m. problems. Not all, but most. Knowing the difference doesn't mean you care less. It means you're thinking clearly. Okay, I want to shift gears for just a second and talk about something important. I want to be clear about what I am and what I'm not. I am not your child's provider. In my clinical job, yes, I diagnose and treat patients every day. That's what I do. But here on this platform, I don't diagnose. I don't tell you what medications to give or whether your child needs to be seen today. That's between you and your child's provider. I'm also not a crisis line. I'm not available at midnight. And honestly, that wouldn't help you build confidence anyway. Here's what I am. I am an educator. I teach you how to think, how to organize what you're seeing, and how to walk into your child's appointment with clarity instead of chaos. That's what the Confident Mom community is. It's not about quick reassurance. It's about building skills over time so that eventually you trust yourself. So, who is this for? It's for moms who make decisions all day. Moms who value evidence and structure. Moms who want to feel capable instead of panicked. If that sounds like you, that's exactly who this community was built for. If you want confidence that lasts longer than the next fever, you'll feel right at home here. If you are done with the doom scrolling and you're ready to start thinking clearly, I've built the Confident Mom community as a place where we keep this conversation going and go even deeper into the topics that matter most to you. You can always jump on the wait list when you feel ready. I'll put the links in both the show notes and the description below. All right, here's what I want you to take with you today. Most moms have good instincts, really good instincts. The problem isn't your intuition. It's that no one ever taught you what to do with it. Confidence isn't something you're born with. It's something you build. And you can build it. Thanks for being here, friend. I'll see you in the next one.